Hi y'all, my name is Rainer Gehagen, and this is my final kinesiology presentation about lower body and spine complex. So, as y'all can see here, this is the pelvis, and it has four main components. We have the ilium, which is the top portion, you have the ischium, which is the bottom portion, and you have the pubis, which is the part that kind of looks like it connects in the middle, and then you have the sacrum, which is the big bony part in the back. Then, as you see to the left, this is what you call a Q angle. A Q angle is a very important part of our body, and it is good to know that there is a difference between female Q angles and male Q angles, about 5%. The Q angle is the angle formed by a line drawn from the anterior superior iliac spine, also known as ASIS, to the center of the patella. Those are the lines that you see right there. The reason why the Q angle is usually wider in females versus males is because the females have to have the babies, which means they need more space in their hip and pelvic region than men. Now, as you see on this slide, we are talking about the extension and flexion of the hip. So, flexion is when the knee goes up, or as you see the guy's raising it to his chest, that is what we call flexion. Extension is when the leg goes back behind the front leg. As you see at the guy at the top, that is what we call the prone hip extension exercise. This is working mostly the gluteus maximus and the hamstrings. Then for flexion, we have exercises like the cable hip pull through, which means that your leg is going back and then you're lifting that knee up towards your chest toward the front of your leg, which is the iliopsoas, the sartorius pectineus, and the tensor fasciae latae, or the TFL. These are all important exercises of our leg that need to be trained so they are flexible and also mobile. Adduction and abduction. These movements are pretty simple, but very few people actually work on them. Adduction is when the leg is going away from the body, and then abduction is when the leg is coming towards the body or past the midline. The muscles that are being worked in exercises like the seated adduction exercise is the pectineus, adductor longus, gracilis, and adductor magnus. With the lying abduction exercises, which you can do with a band or a weight around your ankles, these are the things that work the gluteus maximus, gluteus medius, and the tensor fasciae latae. On this slide, you have internal and external rotation. As you see in this little picture to the left, the right side is external rotation, which that is when your foot goes inside of your other leg, and then internal rotation is when your foot goes outside, towards the outside of your body. I know it might seem a little contradictory, but it's just the way that the hip joint moves when the leg, foot, and knee rotate one way versus the other. There's not too many exercises that can strengthen these areas besides abduction and adduction exercises, but some of the muscles that are involved in these rotational movements are the gluteus maximus, the tensor fasciae latae, and then you have the deeper muscles that are under the gluteus maximus. The knee joint. The knee joint is actually a very unique type of joint in the body. It is a hinge joint. And this joint is very important and has a lot of moving parts, from the bones to the ligaments to the cartilage in between all these bones. But the main four parts of these knee structure is the patella, which is the kneecap, the femur, which is the long bone that connects to the top of the knee, the fibula and the tibula, which are the bottom anatomy parts of the leg. This joint structure helps with movement of the knee and also with weight bearing, shock absorption, and all other sorts of things. Now, with knee flexion and extension, this is where we get to see all the muscles and everything else connected to it. With flexion, we have the muscles like the hamstrings, the gracilis, the sartorius, and the popliteus, which are all around the knee and hip areas. Then for flexion, You have the gastrocnemius and the quadriceps, which also include the rectus femoris, vastus intermedius, vastus lateralis, and vastus medialis. One thing that is important to know about these movements is that with knee flexion, the range of motion usually gets up to a maximum of about 130 degrees, and then with knee extension, it's 0 degrees because it's when the leg is fully locked out. The different type of exercises that work the knee extension and flexion is the prone leg curl, the front squat, the seated leg extension, and then the lateral step up. All these movements are very important and can help strengthen all the muscles that are involved in the flexion and extension of the knee, all the way to the bottom of the lower leg area, which is the foot and ankle complex. The foot has 26 articulating bones and 3 functional units. There are 3 movements that are very common to see in the ankle and foot structure. They are pronation, which is usually around 15 degrees. Then you have overpronation, which is when your ankle goes outside of like over 15 degrees. And then underpronation, when your ankle kind of collapses and it is under that 15-degree mark. All 3 of these different movements can be seen in the top right picture. As you can see, a normal ankle is supposed to be straight with the Achilles pointing straight up with the calf. Then overpronation and underpronation, those angles are off. Then, as you can see in the bottom 2 pictures here, you have the 3 parts of the foot, which are the hind foot, which is closer to the heel, the midfoot, which is in the middle of the foot, and then the forefoot, which is closer to the front of the foot. Then you have the 3 different arches. These 3 are a transverse arc, a medial arc, and a lateral arc. All of these are also common, as you can see, in many different people. Some have flatter arches, and then some have higher arches. The foot are very mobile and very complex. As you can see in this bottom picture right here, we have normal, which is when your foot is at rest and is just at a normal degree of angle. Then you have eversion, which is when your foot goes outside or your toes point towards the outside of your leg, and then inversion, which is when your toes point towards the inside of your leg. All of these are very important to have so your body and your foot moves in correct positions where you don't get hurt. It is also important to have dorsiflexion and plantar flexion. All of these are important when it comes to athletes and just normal people in general, because if you lose these movements, then that's when you start to get injured. So you always need to be working on mobility and also having strength in those ranges of motion. As you can see in these pictures, dorsiflexion is when your toes curl up towards your shin, and then plantar flexion is when your toes are pointed towards the ground past neutral. Some exercises to strengthen these areas and ranges of motion are the standing calf raise, the back squat, the standing toe raise, and the power squat. All these are working that range of motion and all those muscles that are around those areas. The muscles involved in dorsiflexion and plantar flexion are the tibialis anterior, extensor digitorum longus, extensor hallucis longus, and then the peroneus tertius. Then, for plantar flexion, you have the gastrocnemius, the soleus, the tibialis posterior, flexor digitorum longus, and flexor halluc longus. Now we are getting into the last part of our anatomy, which is the spine. The spine has 5 different parts that are most commonly known, which are the cervical, thoracic, lumbar, sacrum, and the coccyx at the very bottom. The main parts of the cervical, as you can see in the picture to the right, are the atlas, the axis, the C3, 4, 5, 6, and 7. These are the main bones that are connected to your spine that connect all the way to your head that help with neck and head movements. Some common injuries of the lumbar spine are lower back pain and herniated discs. The purpose of the whole chain, which is the spine, working correctly is that it will provide mobility and stability to the rest of the body. It is important to know that also attached to the spine is the ribs. There are 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Then, with the ribs, you see there is a bone in the middle right here that looks like it is on the other side of the spine. That is what we call the sternum. So there are 7 pairs of ribs that are connected directly to the sternum, and those are what we call true ribs. Then there are 5 pairs of ribs that are lower than that are called false ribs because they are not directly connected to the sternum. Spine, there are different curvatures that can be observed. Maybe throughout a person's lifetime, it may have changed, or maybe some people are even born with it. On the left side, you can see different curvatures, which are lordosis and kyphosis. Lordosis is usually in the cervical and lumbar regions, it has an abnormal curvature. And then kyphosis, which is usually in the thoracic and sacral region, are more curvature in those areas, which means usually the thoracic area would be pushed forward, and then in lordosis, the cervical could be pushed forward and back. Then on the right side of the screen, you have scoliosis. And scoliosis is just an abnormal curvature of the spine in a lateral position, which means it can be curved left, right. Sometimes they have an S pattern, sometimes they even have a Z pattern. All of these are not recommended because it throws off the weight distribution and weight bearing that your body can handle. Of the spine, specifically the cervical region, you have flexion, which is when your chin is tucked down, extension, when your head goes back, then you have lateral flexion, which is when your head tilts to the side, and then you have lateral rotation, which is when your head spins around left and right. You have the movements of the spine, which are pretty much the same as the cervical region, which are flexion, which is when you've been down, extension, when you've been backwards. Then you have lateral flexion, which is when you tilt one side or the other. And then you have rotation, which is when your body spins around left and when it spins around right. The muscles that are involved in this are the rectus abdominis, external oblique abdominis. You have the quadratus lumborum, and then the multifidus.